when I was going to school, this is what they taught us, is that the average age of menopause is 52. So menopause is complete absence of your period for a whole entire year. Perimenopause can be like 10 years before your average age of 52. I always just say, oh, you know, they're in perimenopause if they're 40 and above. But that's not really true. Like, it can be like in your mid-30s.
Yeah,
and so
crazy.
Women are intuitive. That's the reason why I love this community of women that I'm trying to create, is because you know when your body is not feeling right.
Yeah. You're like, something is off, something is wrong. I'm gaining all this weight. It's like there's different things that are happening that just doesn't seem normal to me.
Mm-hmm.
Yeah.
Yes. If we hit perimenopause in our mid-40s, can you imagine? Or even the women who are in their mid-30s, they hit perimenopause and they go, oh, there's something wrong with me, but never really address it. They're going to go on for the next 20 years trying to figure out what's going on with them. Yeah. So number one, they're not alone. Number two, they're not crazy. Listen to your gut instinct, right? We're intuitive beings. Find the help that you need, and that this is a portal to your well-being.
Welcome to the Mapuana Reed Show. Today we got my girl Christella with us. She's going to take us on a journey because right now I'm in perimenopause. So I got like a bazillion questions I want to ask you. Welcome to the show.
Thank you so much, Mapu, for having me. I'm super honored to be here.
I'm so happy you're here.
Thank you.
Because now I can pick your brain and ask you all the million questions of what's going on with all of this.
Please do. Please do.
Yeah. So tell us a little bit about who you are and what you do.
Okay. I'm a 50-year-old perimenopausal Filipina. I have 2 kids. I have 8-year-old twins, boy-girl twins, and a 5-year-old daughter.
Wow.
And
so you were 45?
I was 41 when I had the twins, and I was 44 when I had Brooke. And I was a geriatric mama. I was what they termed in conventional world as an advanced maternal age female. But yeah, being pregnant and an old geriatric mom was really difficult. So I totally understand this whole perimenopause and what's happening. And so I started actually being a nurse is not my first degree. I actually went to the University of Hawaii and I have an undergrad in microbiology. I thought I wanted to do research and it flipped, and I went back to school to become a nurse at Simmons University and got my master's there. And then I moved to San Francisco, where I did primary care for 2 years, and then had the privilege of working at a women's clinic. I ran a women's clinic there, and I felt like my career had come full circle. I had the privilege of working in a community of women, understanding chronic diseases, and then also, really learning a lot about the women's body. And then I came back home to Hawaii, and I started in the current in interventional cardiology, where I, as a nurse, first started. I worked at the Beth Israel as a nurse in the cardiac floor, and the love for cardiology really came because of strong cardiovascular disease in my family. I saw my uncle pass away when I was 8 years old from a massive heart attack, and it really just hit me. And then the more I learned in the conventional world, 1 out of 3 Filipino Americans have cardiac disease, some sort of high blood pressure, dyslipidemia. So it really drove me when I went to nursing school to really hone in on cardiovascular health. And then I went to an all-girls school, which Mapu. I went to an all-girls high school, and then also getting when I went back to nursing school, I went to an all-females college, Simmons University in Boston, and I always had this inclination to empower women. So my both loves is cardiology and empowering women and women's health. And when I came back here working in interventional cardiology in one of the major hospitals here, I started to discover these big gaps of why are these women getting heart attacks at really young age? Mm-hmm. I thought estrogen's supposed to protect our hearts from having heart attacks. Not to say that men are resistant to heart attacks, but you kind of expect men to get them at a younger age. But for women, I would see this happening, young women in their 50s having heart attacks. Wow. And then I was going through my own transition, like you heard earlier, that I had, babies at a young age. And I thought to myself, oh my God, if I'm in my 50s and I have a heart attack, I'm going to die and leave my
I have young babies.
Yeah, and leave my husband with I don't know, 10-year-old twins, and I don't know. So, and I was going through my own thing. I have PCOS, and I was like, going through mood changes, and, you know, I didn't have hot flashes. I had really sort of like brain fog, not sleeping really well. And 2 years after I had Brooke, I was still breastfeeding her. So this is when I was 46 years old, I was still breastfeeding my 2-year-old daughter. But my primary care doctor was concerned because she's like, Christella, you got to be careful. Your cholesterol skyrocket, like really high. Wow. And your sugar level, my like fasting blood sugar was high, like not super high. I wasn't pre-diabetic, but then, you know, like when you get your blood test and the glucose number turn red, you're like, oh my God, I have like diabetes.
Yeah, right. You think the worst.
Yes, glucose intolerance. Because, you know, my conventional brain, I'm like, oh man, I can feel the plaque building in my arteries. I'm going to be a diabetic because my mom's diabetic. And I was like...
Your mind just starts racing, right?
It does race.
Yeah.
And so discovering all these pockets. And 2 years, like I said, after I had Brooke, I had called 911 because I had these bad cramps. Like I thought I was going to die. Like I was birthing a baby. Like every time I would get I had one bad period. I even went to the emergency room and they're like, no, everything is fine. You just have really bad cramps. And I'm like,
did you always have bad cramps growing
no.
up? Okay, so this was like out of the blue.
Totally out of the blue. And of course, I went back, you know, I went to my GYN, and she's like, well, Christella, we could put you on birth control pills. And I'm like, I'm 46. Why I got to be on birth control pills? Yeah. I definitely didn't need it for, like, you know, for fertility reasons or, you know, prevention of getting pregnant. But that wasn't enough. So I took it for a couple of months, and I was like, I can't be on this. I don't want to be on this. There's got to be more than just birth control pills. Yeah. And then I called ER again. I called the ambulance because I was like, oh my goodness, this cramping is really bad. I really need it. I was doing the ibuprofen, 800 milligrams every 8 hours. Wow. And I was like, I got to do something. And I did a lot of me search and I stumbled on functional medicine.
I like that me search.
My me search, yes. Yeah. And what I started to discover was that all of this was all perimenopausal. I did precision testing, what we call like a Dutch test, to really look at your hormones and see where the hormones were. And I was deep in perimenopause. I thought it was just because I was an old mom, I was having joint pain. Okay. I wasn't really thinking clearly. I was like, oh, it's because
How old were the kids at this time?
Well, I had the twins at 41, right?
Okay.
So with the twins, I was, of course, so the kids were, Brookie was 2. That's when it really peaked, but I could really feel it after I had the twins.
So 46-ish, 47.
Well, I would say 43-ish, actually. Wow. I was deep in my doctorate program, and I was thinking it was just because all the stress, right? I mean, stress can play a huge role. Yeah. I'm not negating that at all. But looking back on it, I mean, even the mood swings, lack of sleep, the mood swings, and it really peaked at 46. So yes. And so I saw these gaps, and I didn't like the way conventional was looking at me. And, conventional medicine is very siloed. You have cardiology, which is the heart specialist. You have gynecology, which is the ching-ching specialist. Then you have endocrinology, which is hormones and your metabolic health. Yeah. But no one was ever connecting the dots with me. I had PCOS. What
is PCOS?
So PCOS is polycystic ovarian syndrome. Okay. And it really, to simplify it, is a higher, you just get higher amounts of hormones, and typically it's testosterone. And what
I thought as we age, our testosterone level goes down, no?
No, not necessarily. Okay. Testosterone doesn't typically drop. It's really the estrogen and the progesterone. So when you're in perimenopause, estrogen can fluctuate from normal, and then all of a sudden it drops or it increases.
Okay, and how do we know? How do we know the days that it's dropping? What are some of the symptoms?
It's kind of hard to say because it could also be progesterone. So definitely progesterone perimenopause decreases. Okay. And the tricky thing is that estrogen is the one that really fluctuates up and down. Oh, okay. But so it all depends, and it's really hard. I'm a firm believer that you don't need to test in order to get hormone therapy. Okay. But I also like to test so we get a baseline, and then we really get down to the root cause, because hormones is not just about estrogen and progesterone and testosterone. Hormones is all about, prolactin, your thyroid, your adrenals, your cortisol levels. So they all interact with each other in order to like create what you feel and how your metabolic health, like what is your sugar doing, right? So they all interact and they play a big role. So I like to get a very good picture of what's happening. I get a full exam of like what you're feeling and how you're feeling, and then I point at and then I really get down to, well, what kind of tests should we look at?
Okay.
Yeah. So, I mean, it may be hormones, it may be all these different things that can happen. But yes, perimenopause is a portal to metabolic health and cardiovascular health. And this is like the prime time to really hone in on your health, like catch it early.
What's the age that it kind of starts? Like, so at what age should women think like, am I entering perimenopause?
Yes, so it could be as early as your mid-30s.
Wow. And what are some of the first symptoms?
Okay, so there's like classic symptoms, right? And then there's like not so classic symptoms, right? So the classic ones that we hear about and the ones that hormones are FDA approved, the conventional way of thinking about it is hot flashes, night sweats, right? So those
night sweats
are
crazy.
Yeah.
I would wake up and I'm like, did I go swimming in my dreams? What happened here?
Yes. And then, the not so classic, some people have told me, and, it's hard to like put a finger on it, right? But like, oh, I have really bad body odor now.
Yeah.
Or like they have dry skin. A lot of like the not so classic one is really the brain fog and the anxiety, like getting palpitations.
Yes. Yeah, the heart palpitations, that to me was just like, I thought to myself, am I having a heart attack? But the thing is, nobody was ever talking about, like, nobody told me how bad it was going to be. Nobody talked about symptoms. Nobody talked about any of these things. Like, it just happened, and I was like, what the F is going on here? Like, I'm hot, I'm cold, I'm losing my hair, I'm gaining weight. Like, just like, it's like, it just hits you like a bus and you're like, what is going on? Yeah.
No, and you totally speak to why I created Integrative Women's Health Hawaii is really to create a community of women who we can start to talk about, like, what are we looking for? And what is this gonna like lead to, right? I totally know what you're feeling, Mapu. Like, I wanted to be a provider in experience with conventional and functional, and like really give the data, really give accurate information about perimenopause and the safety of hormones, right? Because a lot of people think, oh, if you go on hormones, you're going to get breast cancer. With the Women's Health Initiative study, it really did a big disservice to women. And this, like I was saying earlier, this is a portal to prevent metabolic disease process. This is where we catch everything upstream, where we do start to address glucose intolerance or insulin resistance. Like, this is the stuff that we really need to hone in on. And hormones can play a really big role in fixing your metabolic health and preventing cardiovascular disease later on in life. And there are a lot of testing now. If you're afraid to get breast cancer, there are testings where you can actually see how well your body's metabolizing the estrogen. And we can do that with a Dutch test or any sort of like test that actually looks at phase 1, phase 2 of detoxification. So this is the reason why functional medicine is so important and essential, and I'm hoping conventional medicine will jump on the bandwagon, is because it's precision medicine. It's really looking at not just siloed, like looking at your hormones, but also looking at what your liver is doing, your gut doing to detox all these toxins in you that affect like endocrine disruptors, toxins in the food or plastics that you may be consuming, like, as we drink water from like a plastic cup, but like microplastics. And what is your liver doing? Because it plays a big role. Your gut health and your liver detoxification play a really big role on how you detox your hormones. And so, yes. So I mean, functional medicine, I got this opportunity with Integrative Women's Health to really blend the two loves of cardiovascular health and women's health together.
Honestly, I think that that's what women need. Yeah. I know that that's what I need. Yeah. No, seriously, because I feel like it's like, you don't know, you go to the doctor. So for me, I started with the night sweats and the hot flashes and weight gain and the hair loss, like just all the things was starting to happen. But I didn't know about the heart palpitations. So I went to my doctor like 3 different times, to the point where he had like a heart monitor thing that I had to wear for like a whole week. I seriously thought I was having a heart attack. Like randomly, I would just be doing something very basic, like nothing exciting. I would just be returning emails and my heart would just start racing.
Right. But you're not alone. Like it happens. I can even say years ago, and looking back on it, I treated a woman in the conventional cardiology, because I do outpatient cardiology as well. And I did the exact same thing your doctor did. I put her on the Zio patch. I was like asking her, but you know what? I had intuition back then that I was like, this is probably hormones. I know this is hormones. So,
but how come it's not taught? Like why isn't it taught to us? Why isn't it taught to, to you guys? Like, I don't understand. Why wasn't anyone looking into hormones or looking into perimenopause? Because it happens to every woman.
It does. I mean, we have a disadvantage because there's not a lot of research, money in women's health research, right? We don't, most of the research that are randomized trials or good research is, invested in, sorry to say men, but it is.
Okay, so do you think if this happened to a man, if his hormone, if he started to lose his hair, his weight gain, hormone, like all the things that we
all
go,
the
like,
testosterone studies. I mean, that's where we get the testosterone studies from. We borrow it from all these men's studies, right?
Like, it's like, why isn't anyone studying us, people?
Yes. And what I want to tell women is that they're not crazy. So going back to this patient I had, I was like, man, this has got to be her hormones. But my main thing is, my first job is, I got to make sure it's not cardiovascular disease, right? So like, women will present differently for heart attacks, right? We don't get we do sometimes get the like heaviness and the chest pain, but just as simple as women who come in to see me for like what we call chronic fatigue, I get worried when someone tells me, oh, all of a sudden, Christella, I don't have the same energy as I used to. Of course, I rule out the thyroid part, right? But my first brain goes to like, okay, is she having a heart attack? Like, what's her cardiovascular risk factors look like? Does she smoke cigarettes? What does her metabolic health look like? Is she diabetic, pre-diabetic, glucose intolerant, sort of like having that?
And you run all this tests?
I run all these tests.
Okay.
So I'm sorry, if you come see me, you might be with like 12 vials of blood.
Well, that's the thing, like for me, like that's what I want. I want my doctor to run all this tests because I want to rule things out. I want to know, like, I don't want them to only just test one thing and just be like, oh, it's not that, but what about all the other things,
Right.
So that I love. Yeah.
So I look at, functional medicine, like I said, looks at the whole big picture. I try not to silo it, but like I said, I mean, there are there are benefits for conventional medicine, don't get me wrong.
Yeah.
For acute, you're having a heart attack, you need to get into the hospital, get those stents placed in. But my job after you get those stents in is, well, what happened in the first place for you to get this? Conventional is like just kind of like blanket statement. Oh, it's your diet and it's you not exercising. But there's so much more to cardiovascular health than just fat, right?
Yeah.
It's about inflammation. It's about oxidative stress. It's about hormonal health and how hormonal health is affecting your metabolic health. And so I do mitochondrial testing. I look at how well your mitochondrial health is, because you have the highest amount, this is interesting, highest amount of mitochondrial in your ovaries and in your heart. So people used to think the heart has like the most mitochondria, but it's really the ovaries for women and then cardiovascular for the heart. So the more I do functional medicine, the more I'm like, oh my gosh, this is like my bread and butter. I was meant to do this, to like really, like I said, try to avoid the silos, but really diving into like the root cause of disease and looking at the whole person, because that's what's missing. No one's really listening. And I'm in the medical field, which is really sad. They're listening, like maybe, like, what's the analogy, Mapu? Like, you hear one story here and the other story here, but then they're all not talking together,
Yes.
right?
Yeah.
And then it's really hard to get a big picture if you're not looking at the whole person. And it's really important to look at the whole person.
The whole body. We're
whole
all one,
body.
not just down here or up here or up here, wherever. Like, look at the whole thing.
Yes.
Yeah.
And I really am a firm believer about the 4 pillars. We got to really work on sleep. Sleep is essential.
Yes.
Movement. I hate to use the word exercise because that puts a lot of pressure on people. Just moving, like, I teach a Buddha yoga class. I love that. I like to move. I love to dance. And if that's your passion, then getting your heart rate up to 120 beats per minute, 5 times a week is the goal, right? You don't have to like be going on that stair climber or like the elliptical. If
like,
that
do
doesn't
something to have fun.
Yes, do something to have fun. Even like go walking with your friends, right? And talk story with them. So the 4 pillars I'm big on: nutrition, exercise, movement, mental health, and sleep. Yeah. So like really stress reduction is the 4th one. Like what are you doing every day that will help reduce your stress, right? Like
Sleep is big.
It's really big.
Because I feel like when I was going through perimenopause, I started getting insomnia. And so now I take magnesium.
Good.
And that really just helps me get a good night's sleep. I bought the Aura ring.
I was going to say, so like that's the up and coming thing I think women and even men in general should start to look at is these wearable devices because
you can track your sleep.
Yes.
You can track how many times you get up. Did you get a good night's sleep?
Right.
Yeah.
And the most important is like you got to look at your REM. Like, are you in deep sleep where restoration truly happens?
Okay,
right?
so here's the thing for me. There's some nights, like 2 nights ago, I think I did like an hour 45 of deep sleep.
Wow.
Which is shocking.
That's awesome.
But last night, I think I did 37 minutes. And I'm like, what? Like, it's just all over the place. I don't know why, though.
Okay, so that's really good. So sometimes for women like that, I actually have them wear a CGM, which is a continuous glucose monitor. Because you kind of like look at there's so much more. But like looking at your sugar level, making sure you're staying even throughout the evening, right?
Okay.
Alcohol plays a big role.
I don't drink alcohol.
Oh, okay. Good. So toxins, like, I hate to say this, Mapu, because I'm having a hard time. I love my wine. I mean, I lived in San Francisco for 5 years. I would go to the wine countries like almost every month. It was my job. And it's hard for me. I don't drink anything else but wine, and I love it. I love the a good wine, the juiciness of a wine. I don't know. God. And it's just like, day drinking was my thing, right? It just is really fun to just relax, especially when you have all these kids, right? At such a young age. I name my day drinking. No, not when I'm watching my kids, you guys. Come on.
Let's be clear, people.
Yeah, and I don't drink and drive. Especially with my kids in the back. Come on. I know better. But where was I going? See, like, look, the brain fog. No, and so... What were we talking about, Mapu? We were talking about
sleep.
And how important sleep is.
And about how some nights my sleep is just, I get really good sleep, and some nights it's just random. It's just like 37 minutes. It's
so looking at your metabolic health, making sure that you're not doing anything before that, and your stress level plays a huge role, right? Okay. So like, were you anxious to go to sleep that night because you have something big the next morning, right? And it's all your subconscious. Yeah. Like you really, that's why I really am a big advocate for meditation. Even like 10 minutes, like little snack bits of meditation is super important. Yeah. Snack bites of like exercise is important. Now there's that big that recent research where you can do like 10 squats every hour. I got a whole bunch of nurses to do this that I work with. And I'm like, we got to do 10 squats every hour with like the goal of getting 100 squats because it's just as good as 30-minute walking, right? Okay. So like, I got to keep my girls healthy.
You could be cooking. You could be in the shower doing your 10 squats.
Yes. Yeah. Oh. So snack bites of exercise, snack bites of just meditation, 10 minutes. I use Insight Timer for different things.
I heard so many great things about that.
So good. Okay. Yeah. And I'm not advocate. I mean, if you find something that prayer, meditation, anything that will help calm your vagus nerve, that's the goal. Get massages, self-care. Okay. So... yeah, I'm all for self-care because we as women are so dynamic. We wear multiple hats. Yeah. We are women, we are mothers, we are daughters, we are
business owners,
yes,
all of the things.
Everything, right? And perimenopause, or our age, where I'm smacked in the middle of what they call the sandwich generation, where I'm taking care of elderly parents, right? And then I'm taking care of like really young kids. And so there's a lot riding on us. And I, really wanted to create integrative women's health with the mindset of, I wanted to create a community of women. I like to do talks. So it's a membership model, and it's a threefold level. It's Glow, Radiant, and Luxe. And the reason why I came together with this model is I really needed self-care. Like, I want to invest in myself. So what better way to do, you taking care of yourself with, facials and IV nutrients. And I created the model so that it would be affordable. Because nowadays you go and get the big fad is IV nutrients for like mitochondrial health, anti-aging, getting all the nutrients that you need. And I'm a firm believer in it. Like, I really see the needle really moving towards health. And I really wanted to make it affordable. So 1 month, so it depends on what package you pick. You can choose from so it's concierge meets self-care, I guess.
I like that. Yeah.
I don't know how else
I'm like,
to
okay,
put it.
Tell me more. I'm like, there's facials, there's all this
There's
stuff
a functional, and then so or if you need to call me and say, hey, Christella, I have a UTI, can you call me something? And I will be. I mean, I'm accessible on the weekends, and I will okay, I can do that for you.
Yeah.
So, it depends on what you pick, right? So, of course, the high, if you do the Luxe version, I also do neurotoxins, or a lot of people know it as Botox, but I try to do the most purest form of Xywamen. And we talk about aesthetics, and how aesthetics is actually I get down to the root cause of aesthetics, and there's different things you can do to prevent wrinkles from happening. If you don't like needles, then there are other things that we can talk about. But yes, I'm all about self-care, so it depends on which membership you pick. But you could get even the most basic one, which is the Glow, has IV nutrients once a month, or you can do vitamin B12 shots. You can pick, like I said, a functional medicine consult, or
that's all the things that I'm just learning about now. Like, I think as you age, like for me, I turned 50, and it's just things are starting to change, and I could feel the texture. Like here, I'm just oh my gosh, what's happening?
Me too. Yeah. Yes, I feel you. But you know what? There's other stuff, creams you can put on your face.
Yeah.
Prescription creams. Yes. There's so many different things you can do. Yes. But also,
that is so good.
Like I said, the foundation is about your gut health too, right? It's also about movement and, sleep. Sleep plays a big role, staying hydrated.
Yeah.
So we come down to the pillars and really hone in on that, optimize that. Your diet is huge. And then we can do all the fun stuff too. It's not just about the inside, the metabolic health, but it also radiates outwards onto your skin.
Yeah. Okay, take me back to the different packages you have, because I'm so interested in this.
Okay.
Yeah.
So there are 3 different levels.
Okay.
And all of them include either a functional consult or follow-up. The initial consult's 60 minutes, or the follow-up's 30 minutes. So you get that once a month, and it's a monthly plan, and it depends on what you pick. And of course, the higher levels you pick, then you get more services included on a monthly basis. So the first tier is called the Glow tier, and that's the most affordable. So it's $149 a month. Okay. And this is the way I make IV nutrients affordable. So like I said, you could pick functional medicine. So each one, consult, hydrofacial, or any type of facial you would like to pick. And then it comes down to getting vitamin B12 shots, or
all of that for $149.
$149, but you got to pick one of them.
Okay.
So
so you pick either the facial or the shots,
right?
Okay.
And then and it's all on my website or on my app.
Okay.
If you want to get down to the details, but then as you go up higher, the second tier has chemical peels involved. You can get a chemical peel with that, and on the third tier you can get injections, where you can get Botox injections, but I actually use Xywamen injections for anti-wrinkling, and NAD shots if you choose that route.
Tell me about NAD. I just started taking NAD. I heard it's so good for you, but tell me about the benefits of NAD.
So NAD is it is the big thing. So the tough thing with NAD is that the best form really to get NAD and is really not the IV, but it's the subcutaneous form where you get it injected into your stomach.
Oh.
Yes. But it's really meant for your mitochondrial health, and it's also meant for anti-aging. It's a precursor to like drive energy. And so a lot of people like swear by it because they're like, oh my gosh, I feel more energetic, right? Yeah. The biggest thing nowadays is really the precursor for NAD, which is like the NMN. So
I've never heard
yeah,
of
so
NMN.
then maybe really taking oral supplements for that, and then it makes NAD. So yeah, it's the big anti-aging medication, and then also people love it, like I said, for energy, right? It helps with your energy and like on a cellular level.
Wow.
Do you feel a difference when you take it?
I do.
You do?
I do. Yeah.
Oh.
But I mean, I think after I hit 50, I was like, I got to start really focusing on myself and my health and all the things, and that's why I was just so excited to have this conversation with you, because there's something that when I hit 50, which was exactly a year ago, basically, I was just like, things felt different. Things started to shift. I was like, okay, what's like hitting me now? Yeah. But I'm so happy that you're doing what you're doing, like combining all of this together in one place. Instead of me having to go to this person and that person and this, it's just like everything is all packaged together, all in one for what we need in one building with,
Right. And I love it. And I'm really working on trying to create the community. Yeah. Like I was saying earlier, I do love doing talks. And so along with the talks, I like to do Q&A and I like women to come together, be like, what about this symptom? What about that symptom? I try to like host as much, if you have like friends who want to just come and like hang out. So I have a girlfriend who is interested in bringing, she's about, how old is she? About 52, 53, I think. And she has all these friends, they're all talking about, because, that's the age, right? Of menopause or perimenopause. And she's not quite sure if everyone's in perimenopause or not. But.
So let's talk about the difference, because I went to my doctor and I was like, I think I'm going through menopause. And like, he was like, oh, no, you're not menopause, you're perimenopause. But the way I was just like, well, I don't know what the hell is the damn difference. Like perimenopause, menopause.
So perimenopause is the transition. Okay. I like to call it the portal.
And how long does that last? So is that when you're skipping periods and stuff?
Yes, that's when you're skipping periods and you're having like these weird fluctuations, and feeling like you're not in your body. 35? It can start as early as 35.
Okay.
So when I was going to school, this is what they taught us, is that the average age of menopause is 52. So menopause is complete absence of your period for a whole entire year.
Okay.
That's menopause. That's when they use that term, right? So like, say you got your period in April and then you got it again in January of next year. You still haven't hit menopause, right? It's still perimenopause.
So I got to start my clock over again.
You got it.
Oh, gosh.
Yes. So, yes.
Like, no.
So they used to say that perimenopause can be like 10 years before your average age of 52. But now we know it's, so that would be like, 42? So I always just say, they're in perimenopause if they're 40 and above. But that's not really true. Like, it can be like in your mid-30s.
Yeah,
and so women are intuitive. That's the reason why I love this community of women that I'm trying to create, is because when your body is not feeling right.
Yeah. You're like, something is off, something is wrong. I'm gaining all this weight. It's like there's different things that are happening that just doesn't seem normal to me.
Mm-hmm.
Yeah.
Yes. So just go with it and you listen to it. And if you feel like you're not getting the answers, then
it's time to switch doctors,
care.
Honestly. Yeah.
Yes.
And come to see you. No, seriously, because I cannot stand it when I'm trying to explain to my doctor and I just feel like they're just there like this, like, yep, okay, yep. One doctor told me, I was just expressing to them like, okay, this is all the things that's happening to me. And the doctor was like, yeah, boy, you're going through menopause. Like,
I know, isn't
like, I'm like, okay, but what do I do?
Yes.
Like, but they don't tell you what to do. They're just like, it is what it is.
Right.
And I'm just like, what? Like, I don't even know what to expect. I don't know what's happening. I don't know. Am I dying with this heart palpitations happening? I had gained so much weight. It was so crazy. My weight, I was heavier going through perimenopause than I was when I was pregnant for any of my kids, which is bananas to me. Like, I had no baby in me and I was heavier than I was ever pregnant. And I was like, there is something definitely wrong here.
Right.
Okay. So 35-ish they start.
Yes.
And then normally around 52-ish is when women are pretty much done with it.
Yes.
Yeah.
Well,
Okay.
I don't. And it. I
It
mean,
is, I'm sure
it varies.
Okay.
Yeah. So I
That's like the average age, I guess.
I like to go. I like to ask my patients, hey, you know what are you feeling? And then I try to connect the dots, right, for them, and like draw a big picture, not just a siloed picture. But also, like, functional medicine has their lab testing is very tight. We like to be very precise about like what we're trying to prescribe for women. And so even though your doctor might say, oh, this is normal, or like if you have like a red, like, you look at the labs, right? Because we have access to our lab results now. And if you have something that's red and they're like, we just keep monitoring this. Like, what's the root cause? Like, why is bilirubin elevated for reasons? Like, like no one talks about that.
Yeah.
Or like, why is my glucose why is my glucose high?
Yeah. Why is my cholesterol going up?
Right.
And
I got
all of it.
Oh my gosh, my cholesterol was, talk about Filipino cholesterol. Like, it was high. And I've had it high since my 20s, but to the point where, most medical professionals will understand this. My LDL was like, and I'm not proud to say, it was like 189. That's what total and my doctor friend was like, wait, does that you mean your total? I'm like, no, it's my LDL. It's the one that creates plaque in your arteries. But then I realized with functional medicine, not all cholesterol is created equally, and there are other specific tests that you look at, right?
Yeah.
Your LP little a, you look at your ApoB, how sticky your cholesterol is. And so I did my breakdown of my cholesterol, and I was like, whoo, and I did a coronary calcium. See, I did all this stuff myself because I didn't want to be like, leaving my poor husband with like babies, like little kids younger than 10 years old.
Yeah.
And I did it for my husband too, because, I don't want him dying on me either.
Right? Yeah. What do you wish every woman knew when she's entering perimenopause? Like, what do you wish she knew?
That you're not alone and that you're not crazy. That was the one thing in my head, even as a provider, as a medical, conventionally trained nurse practitioner, is that, it took me years to figure out, what was happening with me, and that you don't have to do it alone, that there's more to it than what you find on Google search. So find someone that you can work with. Mm-hmm. If you want a second opinion, please feel free to call me at the office. You could definitely schedule a consult. But yeah, that the symptoms, that perimenopause really is, like I said earlier, a portal to your future, right? If we hit perimenopause in our mid-40s, can you imagine? Or even the women who are in their mid-30s, they hit perimenopause and they go, keep thinking, there's something wrong with me, but never really address it. They're going to go on for the next 20 years trying to figure out what's going on with them. Yeah. So number one, they're not alone. Number two, they're not crazy. Listen to your gut instinct, right? We're intuitive beings. Find the help that you need, and that this is a portal to your well-being. We can address chronic diseases upstream, and this is a time for protection and for addressing health. And, if you're not sure, there are great things that you could do, right? Like, there are wearable devices that you can do to monitor your sleep, your heart rate variability, your sugar level. So there are different things we can actively do, and we can be proactive about it. Mm-hmm. So if you guys want to make an appointment or switch over I could be your new gynecologist, you can call me at 808-272-3651 is the office number. I have a website, www.womenshealthhawaii, which hi.com, and then, or follow me on Instagram, Women's Wellness High.
Perfect. Okay, I love it. Thank you so much.
Thank you.
I seriously could pick your brain for like a whole nother hour, but that was so valuable. Thank you so much for sharing all that you did. Like seriously, like I've learned so much just from this 45-minute conversation. So
Great,
thank you.
Mapu. Thank you for having me. This was fun.
It was. I loved it. Thank you.
Thank you.
Thank you so much. All the links are going to be in the show notes. So if you want to connect with her, it will be all in the show notes. Thank you so much for listening, and see you on the next episode.